We know that there are a lot of people across America that desperately need help when it comes to healthcare, the cost of health insurance and all of that. And unfortunately, their desperation sometimes lands them in what effectively amounts to a scam, although one that's sort of packaged as something incredibly wholesome. And so I want to talk a little bit about some of the work that was unveiled in The Tennessean by Kelman earlier this week. He was writing about a spike in the uninsured rate in Tennessee. And he said that one of the reasons that has happened is because 31,000 Christians in the state have gone from traditional insurance off to sharing ministries. So I had not been familiar with these sharing ministries, but they are apparently pitched as alternatives to medical coverage, but they're not health insurance. Rather, they're better described as religious crowdfunding ventures where fellow congregants may cover your medical bills. More than 1 million Americans struggling to cope with the rising cost of health insurance have joined such groups. Obviously, Tennessee has a small number in comparison to a very large whole. So here's what you need to know about these alternatives to insurance. They're not bound by any of the Affordable Care Act regulations, meaning they can deny any essential benefits they want and to deny coverage for pre-existing conditions, but they have the added twist that for those who are refused coverage, they're urged to use faith and prayer as a substitute for medicine. According to Kelman, these groups don't actually guarantee any payment. And if you break their rules by, for instance, smoking pot or having unmarried sex, you're on your own. And you don't get your money back that you've been putting in, and it can be a substantial amount. Let me give one example very briefly. So there's one group, Samaritan Ministries, refused to pay medical expenses for a child named Blake Colley, whose family owed hundreds of thousands of dollars after he was hospitalized for a brain aneurysm. Samaritan Ministries, despite charging hundreds in premiums, does not cover any hospitalization over $250,000 and instructs patients who are denied to, quote, just trust God. To put it in perspective, because you might think, well, maybe these are really inexpensive at least. Blake Colley's family was paying $530 a month in premiums and then got nothing for it.
And when you say premiums, you mean this pot of money
alternative to premiums? Yes.
Their particular religious institution asked them to pay for so they could collectively have this community.
Yeah.
Now, two things. Number one, we always, even when we've had the primary, not even the primary, but one of the debates about healthcare when Obama was in office, and they were saying, how could you actually want to provide anyone with healthcare in this country? We don't do that here. Because let's not forget, that was the narrative at first. Now that these Republicans are saying we want to make health insurance better, we want to make the Affordable Care Act work for you, and we want to cover people and do that, all that stuff that they're saying now, they wanted none of that before. First off, let's not forget that. They didn't want any of this. And one of their excuses was, you can go to the emergency room, that's healthcare. And also, we have our-
seriously, that's crazy.
That was their answer for healthcare. Go to the emergency room. And number two was, we've got religious institutions, we've got faith centers, we've got your communities that you can pool together and have that as the people who can't afford this private health insurance. This is the situation here. This is what you get when you have everyone pool their money in a religious center with no guarantee and no overarching legislation that forces them to actually do anything for you. So one of those, the point being, in 2018, I believe, the administration, Trump's administration, opened this up and allowed for these things to happen more because they pulled back and said, hey, any group that wants to provide any kind of other short-term healthcare insurance that can go to up to a year can do so. And it basically opened up this market for people, honestly, to, I hate to say scam, because I wonder to what degree many of them actually want to do some good, but then after they see the true cost of providing healthcare for a small group of people that maybe one of them needs 6 figures worth of healthcare, then they go, we can't pull that off, or we don't want to pull that off because we have to think about other people. It allows for these situations to come up. It's not just an aside. This is how these things are born.
Exactly, and I want to be very clear. I'm not trying to imply that this is particularly devious because it's a religious organization or that religious organizations don't provide a ton of actual help to people in need. This is sort of a crowdfunding thing, and we know that for a lot of Americans, crowdfunding is your only bet. And a lot of those, you've probably seen a million of these GoFundMes and stuff like that. Many of them are led by religious institutions. Certainly many of them are supported by religious institutions and religious individuals. People's religious faith cause them to be incredibly charitable. And there's a lot of Americans who, because our system is so terrible, have had to turn to that sort of charity. And so we certainly appreciate that. But these organizations have caused a lot of trouble for a lot of people. And they are, as you pointed out, they were designed by the Trump administration, not necessarily by individual ministries, but by the Trump administration to give the appearance of people having access to health insurance, but with none of the regulations that make health insurance actually worth a damn. That was what we had back before the ACA. Some people had plans that were still incredibly expensive, wouldn't actually cover anything, but sort of technically of health insurance. The ACA didn't just expand access to health insurance, it made the health insurance actually mean something. It has tons of its own problems, but that was one of the things it actually did. And we've been moving the exact opposite direction over the past few years.
Yeah, if you allow rogue things like this to happen, then rogue results will come. And it's just the way it is. You can't have just a random doctor do whatever he wants. Say, I'm a doctor, I'm gonna do some surgery on you. No, you have to be under the right rule of law to do it.
Yeah, exactly. So this is certainly unfortunate, but Brent Kelman of The Tennessean, great work there. And you can find, thankfully I was able to find in my research, quite a few people are starting to talk about this, especially as the numbers are rapidly rising. Check out the Damage Report podcast each day, wherever you get your podcasts, whether Pocket Casts or Stitcher or iTunes. You can join me as I give you the news and stories you want, with a range of co-hosts and interview guests jumping in on the fun each day. Again, that's the Damage Report, wherever you get your podcasts. And if you get them at iTunes, don't forget to rate and review. Sometimes I'll read them live on the show.